In today's Eye on Health segment, when you have a headache, sometimes over-the-counter medicine doesn't help, and you're willing to try anything and everything to get relief fast. That's where the new Allegheny Health Network Headache Center can help. Doctors Dolores Santamaria and Andrea Sinowick are here to tell us about treatment there. Welcome, and we're talking about frequent, severe headaches, not the kind that you can take some Tylenol or ibuprofen. We're talking things that are debilitating.
Exactly. We're talking about migraine headache, which is the most frequent primary headache disorder. Around 40 million Americans are suffering from this disorder, and it's a true neurological disorder. And also, state-of-art primary headache center are offering help for those patients. So we're really privileged to represent Allegheny Health Network Headache Center, which opened a year ago, and we have medicine-based new therapies right now, and we're opening right now an era of new treatments for those patients.
So is it different for every individual? What causes migraines? Is there a root to the problem?
I think at its heart, it's still a little bit of a mystery. What's the very first thing that happens when someone who has a headache disorder gets a headache? What we know is that they're very common, and unfortunately, they're very disabling.
Right.
So when we look at a global health perspective, it's actually the 6th most common disabling condition worldwide. So even though it's a common thing that we don't have a perfect understanding about, we know that the brain releases all of these neurotransmitters which propagate pain throughout the head and neck. And we know some good ways to prevent and also treat headaches when they occur.
My mom used to get migraines, and I remember she used to have to lock herself in her bedroom, close the blinds. I mean, really, it knocked her out for the day.
And it's really, here's that you said that it's more frequent in women than in men, and we think most likely estrogen has that potential trigger. We talk about a lot of triggers, and lifestyle modifications can be one of them, but one cannot be modifiable.
So I feel like in some of the women, at least that I know, we don't often want to get help. We're very quick to tell people that they should go see somebody, but not as quick to get treatment for ourselves. So what do you offer at the headache clinic?
We do have outpatient and inpatient, as well as oral procedures. We do offer nerve blocks, trigger points injections, Botox treatments, but now we're opening a new era of pathophysiology is behind these new treatments, and we're talking about scientific proof, specific preventative therapies for migraine patients. Last year, we're really fortunate. Actually, we're living in the era of new treatments. And last year, FDA approved first-in-class monoclonal antibody therapies.
Wow.
The first was Aimovig, which is aranimab. Later that year, in September, Ajovy as well as Emgality were approved. And those are injectable, once a month, preventative therapies.
Wow.
And we see an amazing response on patients.
So let's say you're a frequent migraine getter. I don't know. What would the first appointment call, and then would you sit down and talk with someone about the frequency of your migraines? How does that the first appointment?
Exactly. We do have a lot of referrals, and we have a special questionnaire. A patient thoroughly looks through that. And for us, really important to understand headache frequency, severity, and to make a diagnosis. There's a lot of headache disorders, primary and secondary as well. So for us, really important to differentiate that, to make sure that there's no brain tumor.
Right.
And then once we focus on the primary headache disorder, and majority of patients we do diagnose with migraine, 84% approximately in our practice, we try to focus on non-pharmacological therapies first.
Okay. So without medicine,
without medicine, we try to identify triggers. We offer natural supplementations as well, vitamins. Lifestyle modifications really important. And then we're trying to focus on pharmacological, and now we're actually in the era of bioelectronics, which those devices are provided to patients that are not able to use a medication because of the side effects.
Right.
So you use those devices, and actually they can reverse the pain.
So I know sometimes you need to get referrals. Is that the case here? Do you need a referral to get into the clinic, to get into the center?
Most of the time not. It really depends on the insurance company, but Allegheny Health Network has really been wonderful in making same-day appointments available even
Great.
sometimes, so patients can call and hopefully see a specialist very quickly.
I know people that suffer with them need and want relief very quickly. Thank you, ladies, so much for joining us today. And to learn more about help for migraines and other severe headaches, visit the AHN Headache Center located in West Penn Hospital on Liberty Avenue in the heart of Bloomfield. You can also check out the center's website for helpful information about identifying the type of headache you get, how to find a doctor that can help, and even to make an appointment. All of that is online, and we've posted the link for you to make it super easy at pittsburghtodaylive.com. And keep watching for our Eye on Health series here on PTL, sponsored by Highmark Blue Cross Blue Shield, together with Allegheny Health Network.